The professional care domain consists of administratives, your health professions, as well as pharmacies and surgeons. The non-professional care domain is these outside communities, these outside companies that use the patient's information as well. So if we were to architect this entire system, it becomes a headache. It actually becomes a huge task because you have to deal with compliance and regulations on the health information to protect the integrity of the patient. So some of the main challenges that's facing the health IT industry is that there's an overabundance of increasing new procedures as well as a new volume flux of requests of the information. In addition to that, there's also new users who are looking to go around the IT infrastructure completely. On the infrastructure challenges, there's new threats that are looking to access this information. One point that I'll get to in a little bit is this new idea of bring your own device. We have new health professions who utilize the new devices such as tablets, phones, and because the data is stored on these devices, your patient information could get into the wrong hands. So the landscape is changing. Worldwide healthcare data is expected to grow 50 times by 2020. So we have to expand our data centers. Patients want access to providers in new ways. So patients want to be able to access their data on the web, the same way they access their social media, the same way they access their financial bank statements. Mobility as well, this idea of bring your own device. I don't want to use the same Mac from 2002 to input my data from my patients. In addition to that, control and compliance, there's new regulations around the health industry and IT infrastructure that's causing new regulations to be inputted into the system to protect the electronic health records of the patients. Finally, the mind share of technology. A recent study showed that 74% of patients are comfortable with having their information stored in the cloud as long as it's safely secure and it's private. So to bring this all back, security is a huge talking point when it comes to healthcare IT. Since 2009, 21 million health records have been compromised in major HIPAA security breaches. 63% of that, or 35% of that was due to the BYOD. These devices are being taken, they're being stolen, and healthcare or health information for your patient are being captured by hackers. Health applications. 59% of physicians and insurers believe that adoption of mobile health applications is unavoidable. So we want to re-innovate and rethink the way we give our patients access to this information. In addition to that, we need IT that adheres to compliance because you'll receive some type of fine based on the country or state that you live in. And these are just icings on the cake when we think of health IT. Data analytics. With all this data that's being inputted into your system, let's make sense of that, of the data and information that's being inputted. Disaster recovery goes along the lines of geo-redundancy. What that means is, based on a health provider, if they are willing to store their information and their data into the cloud, we need to have a backup system in place just in case medical providers are unable to access it. And finally, the last main point is to lower costs. When we lower costs, we can provide our patients more, a better system for them to interact with, because we could allocate those funds to other means. So what does a cloud-enabled data center look like? Currently, on-premise or your health IT infrastructure looks like something on the on-premise side. They have to monitor networking, storage, operating system updates, data, applications, all these different segments of the infrastructure. When you start to move into cloud, you start to give the access, you start to give the management of those different portions to the cloud provider. In one sense, IaaS, which is infrastructure as a service, you no longer have to manage the virtualization of your IT infrastructure. You no longer have to manage the networking of that. The vendors and the providers manage that for you, so you can focus on the application and the data that you're inputting into it. For platform as a service, well, yeah, that was platform as a service. And finally, for software as a service, we provide you an application that you interact with, and we'll manage the entire tier. So what does that mean? We get to transform how we think of the data center. With you focusing less on maintenance and your IT team providing new updates to your system, these vendors are going to do that for you, so you can focus more on the web front tier that your customers interact with. So just in case you do have some type of disaster on-premise, you could switch over to the cloud while you figure out and get your on-premise IT infrastructure running. Another service to point out is Traffic Manager. If you have global customers, Traffic Manager will be the service that they interact with to basically ping and get information from these different IT on-premise solutions. And let me actually break that down a little bit more. Traffic Manager is it's a service in front of your web application. So if I was in the UK, if I was in Germany, they would interact with the different web points on the internet in these different countries. And from that, we enhance the speed and the scalability of how they interact and receive information from the cloud. This is just some stats about Azure. We have over 10,000 new Azure customers a week. Over 2 million developers registered with Visual Studios Online, so that's usually the standard .NET if you're using SQL Server and SQL database inside your IT infrastructure. This allows a pretty easy shift over to the environments you're probably currently using. Another one would be over 30 trillion storage objects in Azure. So we have the capacity to hold your IT infrastructure and storage databases inside our system. if we were to go a little bit further into a conversation about security and privacy, why should I trust my information inside the cloud? When you interact with some of the largest cloud providers such as AWS, Google Cloud Platform, and Microsoft Azure, we have compliance and certifications that support your health IT when we architect solutions for you. One to point out is HIPAA, which supports the electronic health records that are being stored into the databases. Another one would be PCI, which supports the payment credit card interaction with your database or your application that you're looking to architect with the cloud. So this also touches upon how a hybrid interaction with the cloud looks like, with storage, networking, and computing being the easiest way to go ahead and create these touch points with cloud providers. So we're going to take a look at McKesson and how they were able to, they're actually based here in San Francisco. We're going to take a look at how they were looking to utilize the cloud and its elasticity and its scalability to create a new solution for their customers. Some of their business needs included providing a cloud-based analytics service for their customers. They wanted to be in compliance with high tech and HIPAA, which is just based on assuring that electronic health records are safely stored and encrypted inside a cloud database. They wanted to create a secure and easy way for customers to access their applications. And they also wanted identity directory solution that integrates with their on-premise technologies. So what that means is creating some type of single sign-on for their medical professionals to interact with their information that's stored on-premise. So when they came to us at Microsoft, they used 6 different services. Azure SQL Database is the cloud version of your traditional SQL database. So instead of paying for the size of what you're storing into your database, we could scale out how many inputs and how many queries that you're using when you push to your different databases in the cloud. They also use Azure Blob Storage for images. Blob storage is just a basic generic, it's binary. So when you're inputting data inside blob storage, it could be of any type, text file, image file. They also utilize Azure HD Insight service. HD Insight is Hadoop clusters. Hadoop clusters are used for ingressing against these different databases. If you have huge, large databases and you want to make sense of this, then use Hadoop clusters. Azure Active Directory is one of the common use cases for the cloud. If you have a authentication service for your customers and how they interact with your system, Azure Active Directory allows some type of federation architecture, so when they sign into your network, they could also sign into the database that's storing your information on the cloud. Visual Studios Online is the new environment for developers to create some type of application lifecycle management for their development. And we have the compliance story for electronic health records using HIPAA and high tech. So impact on business, we simplify their development, we increase their scalability of how of what they pay for, instead of paying for a set static parameter of data that they're storing inside their databases, they can increase it and decrease it based on the information that is being applied at that moment in time. In addition to that, we provided them a flexible and effective security system. So looking forward, what does cloud look like? Well, currently, 87% of health industry providers are currently using cloud in some sense or another. 67% are using that in a SaaS way, so software as a service. So that would be Box, for example, just a storage site where they could, store patient data inside of that. This weakens, another area of opportunity, it weakens the barrier of entering the health industry. So now startups and small, medium businesses can enter the health industry because they don't have to pay for these large databases or these large infrastructures to support their customers. And with that, that cuts cloud costs, or it cuts costs for your IT team. Areas of improvements as we look at the cloud, we have to be able to minimize downtime and unavailability. So there are service level agreements that you use when that you agree upon when you sign up with cloud providers. And you are going to experience some type of downtime. The way to get around that issue is to architect solutions in the cloud that assures that when you receive a downtime with your cloud provider, it will just push to another data center inside that cloud provider. So an example of this would be, let's say the West US data center for Azure is experiencing some sort of downtime. And I'm having an influx of users pinging my service or my application. They will be able to access it or the data from a different location if I created a replication of that database inside the East US data center, and then they'll switch over automatically, and I have to do nothing basically instead of creating all these power scripts for them to switch over to the other data center. Another area of improvement that we also need to consider when it comes to the cloud is we have to rethink regulations and international policy. One example of this would be Canada and US. If I'm a patient inside Canada and your company has cloud data centers inside the US, will my patient information be accessible to the US government if they were to audit your company? So looking forward, what does the information or the data for a patient look like? We're no longer going to see this two distributions of domains for a patient, where one side being professional care domain and the other side being a non-professional care domain. We'll see a singularity around the patient, and the patient will be able to share their information and their data about their health with who they want. So insurance, their primary care teams, their pharmacy, their family. And as we move with the cloud, this would be a lot easier to do, where IT is more elastic and scalable in the health industry. Geez, this looks a lot different on a PC. So our vision for a new health experience is to be able to empower you to create a new IT solution for your company. And with that, as devices become more powerful, we need to be able to have a back end that manages these devices and manages this data that you're injecting into your company, your healthcare IT solution, using the cloud services. For more information, you can visit microsoft.com/health and find out more about our local partners here in San Francisco. And if you want to dive deeper into the compliance story and the regulations around health industry and health IT and HIPAA and high tech, you can visit our Azure Trust Center for that as well. Thank you. And I guess we'll leave this time open for any questions. I expected or anticipated a lot of questions about security and privacy.